Have you ever felt your heart pound, your palms sweat, and your mind go blank at the mere thought of a social gathering? Perhaps a presentation at work, a casual dinner with new acquaintances, or even just making small talk with a stranger. That intense wave of dread, the overwhelming fear of saying or doing the wrong thing, of being judged or scrutinized, is a deeply unsettling experience many of us have faced to some degree. But for millions, this isn't just a fleeting moment of shyness. It's a persistent, debilitating condition known as social anxiety disorder or social phobia. Unlike normal shyness, which can be a temporary discomfort, social anxiety is a pervasive fear that significantly interferes with daily life, impacting relationships, careers, and personal well-being. It's a condition that can make the simplest social interaction feel like scaling a mountain. Today, we're going to explore what lies beneath this intense fear, why it happens, and more importantly, how we can navigate it with 5 practical, evidence-informed strategies. To truly understand social anxiety, let's first look at how it manifests. It's more than just feeling nervous. It involves a complex interplay of mind and body, often leaving individuals feeling trapped. Psychologically, individuals often experience intense worry before, during, and after social situations. There's a profound self-consciousness, a constant fear of embarrassment or humiliation, and that frustrating feeling of your mind going utterly blank when you need it most. This often leads to actively avoiding social gatherings, creating a cycle of isolation. They might fear others will notice their anxiety, which only makes it worse. Physically, the body reacts as if it's facing a real threat. You might experience blushing, trembling, excessive sweating, a rapid heartbeat, or even chest pain. Nausea, dizziness, an upset stomach, shortness of breath, and tense muscles are all common physical manifestations, essentially your fight or flight response kicking into overdrive in a non-threatening social setting. So why does this happen? The exact cause of social anxiety disorder is complex, emerging from a delicate balance of biological, psychological, and environmental factors. Think of it like a puzzle with many interconnected pieces that contribute to the overall picture. On the biological side, there's a strong genetic component. It tends to run in families, suggesting a predisposition. Neurologically, research points to an overactive amygdala, which is essentially your brain's alarm system for fear. Imbalances in key brain chemicals like serotonin, dopamine, and glutamate, which regulate mood and anxiety, also play a significant role. Environmentally, our early experiences can leave a lasting imprint. Childhood experiences of teasing, bullying, rejection, ridicule, or humiliation can significantly increase vulnerability. Imagine a child constantly made fun of for speaking up. They might learn that social interaction is inherently unsafe. Factors like family conflict, childhood trauma, abuse, or even overly controlling parenting styles can contribute. Sometimes, simply observing anxious behavior from parents can inadvertently model similar responses. And new social or work demands can also trigger or exacerbate existing anxieties. Temperament also plays a part. Children who are naturally shy or withdrawn may face a higher risk. It's important to note that social anxiety rarely travels alone. It often co-occurs with other conditions such as depression, other anxiety disorders, ADHD, or even substance use disorders, complicating the picture further.
Social anxiety is not a new phenomenon, but it's a significant and ongoing concern, particularly relevant in our modern world. The recent COVID-19 pandemic, for instance, has been linked to an increase in anxiety disorders, including social anxiety, potentially due to prolonged isolation, and then the jarring return to social norms. One of the most concerning aspects is how widely under-recognized and undertreated it is. People often suffer in silence for an average of 16 years from the onset of symptoms before seeking help. This isn't surprising, given the core nature of the disorder itself. The fear of judgment often prevents individuals from reaching out, creating a massive treatment gap. There's an increasing focus on public health initiatives to improve diagnosis and treatment engagement, making it a critical area of ongoing attention in mental health. Now, let's shift our focus from understanding the problem to exploring the solutions. The good news is that social anxiety is highly treatable, and a combination of professional guidance and self-help strategies can make a profound difference. Here are 5 practical fixes that can help you reclaim your social confidence. 1. Cognitive behavioral therapy, or CBT. Considered the gold standard in therapy, CBT helps you become a detective of your own thoughts. It teaches you to identify and challenge those negative, often distorted thought patterns that fuel your anxiety. For example, if you think, everyone will think I'm boring, CBT helps you question that thought and replace it with a more balanced, realistic perspective. while also guiding you to change avoidance behaviors. 2. Gradual exposure, or behavioral experiments. This technique is about gently, systematically, and safely confronting your feared social situations. You start with something mildly anxiety-provoking, like making eye contact with a stranger, and gradually work your way up to more challenging scenarios, such as joining a small group conversation. Each step is a small victory, building confidence and proving to your brain that your fears are often unfounded. It's like building resilience, one brave step at a time. 3. Mindfulness and relaxation techniques. In the midst of anxiety, our bodies often tense up. Mindfulness involves bringing non-judgmental awareness to the present moment, observing your thoughts and feelings without getting caught up in them. Combined with relaxation techniques like deep breathing, for instance the 4-7-8 method, where you inhale for 4 counts, hold for 7, and exhale for 8, or progressive muscle relaxation, these practices can significantly calm your nervous system and manage those uncomfortable physical symptoms. 4. Improve social skills and shift focus. Sometimes the fear of social situations is exacerbated by a perceived lack of social skills. Learning and practicing simple skills like initiating conversations, maintaining appropriate eye contact, and active listening can build your confidence. Crucially, try shifting your focus. Instead of intensely scrutinizing yourself and worrying about how you appear, try to genuinely engage with others, focusing on what they are saying and experiencing. This outward focus can naturally alleviate the intense self-scrutiny that fuels anxiety. 5. Medication under professional guidance. For moderate to severe cases, medication can be a valuable part of a broader treatment plan. Healthcare providers might prescribe selective serotonin reuptake inhibitors, or SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs, to help regulate mood and anxiety over time. Beta blockers can be useful for performance-only anxiety, like public speaking, by calming physical symptoms. And while benzodiazepines can offer short-term relief for acute anxiety, they are generally used cautiously due to potential for dependence. Remember, medication should always be discussed and managed by a qualified professional.
Understanding social anxiety, its roots, its symptoms, and its profound impact is the first step towards managing it. It's a common, treatable condition, not a personal failing. The journey to overcoming social anxiety is unique for everyone, but it's a journey that doesn't have to be walked alone. With increased awareness, reduced stigma, and improved access to effective treatments like CBT, gradual exposure, mindfulness, social skills training, and when appropriate, medication, more and more individuals can find relief and reclaim their social lives. If you or someone you know is struggling, remember that reaching out for help is a sign of strength, not weakness. There are pathways to feeling more comfortable and confident in social situations, allowing you to connect with the world and the people around you in a way that truly enriches your life. Embrace the possibilities of positive change.